following paid program does not necessarily reflect the views of this station, its staff, or Clear Channel Media and Entertainment.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedic, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome back to The Moving Body, this time live, December 13th, 2014. Here to take your calls and try my best to answer your questions regarding arm, leg, neck, or back problems. Anything related to sports medicine. We have the Honolulu Marathon coming up, so I'll have a ton of people come into the office on Monday usually with sore this and injured that and torn muscles and stress fractures and shin splints and back pain and sciatica and knee pain and swollen joints. It's a mess. But admirable mess. I've done it myself a couple of times. And that's always exciting. But if you have a question about sports injuries or other types of injuries, car-related accident injuries, work-related injuries, injuries occur around the house. And, you know, sometimes I see patients that weren't injured. Or at least they don't recall injuring themselves. They simply wake up with a stiff neck or wake up and their back is sore. They don't know why. So we don't always know the cause of these injuries. And sometimes they're not exactly injuries, but rather conditions that sometimes people have something going on that inside their body that has nothing to do with falling or lifting or sports, but that causes some sort of inflammation or pain in the limbs or in the back, and we have to be very careful. Sometimes those conditions are rather serious. Anyway, here we go. Coming into the last couple of shows of the year, I'll take my first caller, Larry. Go ahead, Larry. You're on the air, and thanks for calling.
Good morning. I just wanted to give you super kudos. You've been treating me and my wife for about a year now from a serious car accident, and you're just amazing.
Whoa, you got me. So where do I send you the check? I lost that. I got a shill here, everybody. No, I appreciate the kudos. It's, you know.
Well, only I guess is your alternative to, you know, looking at having surgery, which, you know, there's so many complications.
Right, yeah, we all want to avoid surgery. Even surgeons, the good ones, want to avoid surgery. And while I'm not a surgeon, I'm a non-surgical orthopedist, and I specialize in not just trying to specifically diagnose the problem, which tendon, which ligament, which muscle, but to be aware and expert at using all these various non-surgical treatments. We don't want to use a treatment just because it's non-surgical. It has to also be safe and effective, you know, because we could put garlic lays on people's necks, and that's not surgical.
Yeah, but no, you've been amazing to Larry and Liz.
All right.
And we just wanted to thank you so much.
Well, thanks for the call. It picks up my whole day here. Thanks, Larry. Have a nice holiday. Take care. Bye. Wow, that's kind of nice. Let's see. Danny, go ahead. You're on the air, and thanks for calling.
Hi, good morning, Dr. Portner. I really enjoy your show.
Thank you.
Okay, I have just problems in my hand.
Yes.
It's actually the joints, my pinky joint and my pointing finger. It's just really less flexible, and it's like my pinky's kind of curling up now, and I often kind of like forcefully kind of make it straight, but it doesn't work. So it just seems like
Larry, let me ask you something. Danny, when your pinky finger kind of curls up and you can't straighten it and you have to force it with your other hand, do you force it, and then it suddenly gives way and straightens out?
I wish. No,
it's just stiff. And can you specify which joint you think is the culprit? Is it the one closest to the hand where the finger attaches to the hand, or is it the one closest to the fingernail?
The other one, not the fingernail one. The
Closest
next
to
one.
the hand, the knuckle, basically.
Yes.
I see. And that's isolated to the pinky and the index finger on one hand?
Yes, just my left hand.
Are you left-handed?
I'm actually right-handed, but I like to play a little bit of guitar sometimes, and it's
so you're using that for fingers.
Yeah, so it's hard to play those keys.
Right, right. And this has been going on for how long?
For at least a couple months.
When you look down at your hand, do these joints look swollen or red, or are they warm?
Not at all. Just that when I just look at my hand, just the pinky is a little curled, and it looks fine except for the pinky, just a little bit, curved.
Do you drink alcohol?
Used to.
Used to. And when you look at your palm, are there any tight bands under the skin in the palm leading to your pinky? You feel anything that's sort of stringy in there? Like a guitar string under your skin?
No, not really. Actually, my thumb too. I used to be able, how you could bend it the other way. I used to be able to do that pretty good, but now it's just straight and I can't even bend that.
Have you seen a doctor or had an X-ray done?
No, I told my doctor, but he told me to go see an orthopedic. Is that what you are?
Yes, that is true.
Yeah.
I'd be happy to have a look at this. I believe that when your doctor said see an orthopedist, he was talking about an orthopedic surgeon. But, this is not likely a surgical problem, and I'm a non-surgical orthopedist, perhaps more appropriate.
Okay.
I do send patients to see orthopedic surgeons sometimes when I think they need it, or when I think I've exhausted all non-surgical treatments and now it's time to get a surgical opinion. But this is what I do, so I'd be happy to have a look at it. It's either a joint problem or perhaps a tendinous problem, what's called a trigger finger, what we call tenosynovitis. What I was getting at with that guitar string under your hand, there's an interesting syndrome that causes the baby finger to curl that's seen in people who drink a lot of alcohol usually, and causes these tight cords under the skin in the palm. But I guess you don't have that. Anyway, the options, the possibilities are not many, just a few. And we can usually figure it out. How do you feel first thing in the morning? Is it most stiff then?
There's no pain at all. Absolutely no pain.
But the stiffness you're talking about, is it mostly in the morning or mostly after you try to use it for a while?
Well, it's always there kind of thing. Right. I just try to make it.
Well, Danny, give me a call. I'm only working another week this year, so you might be able to squeak in before the end of the year. Otherwise, I can certainly see you after the holidays. But call the office. I don't know if anyone's there today, but if you leave a voicemail, they'll call you back on Monday.
Okay, thanks.
All right?
All right. If it works, I'll play your song.
Hey, I'd love that. Thank you. Thank you, Danny. Take care. Thanks for the call. Yeah.
Take care.
Bye-bye. Let's see. 521-8383. If you're listening from a neighbor island, you can call 1-888. That's toll free. 1-888-565-8383. Rose, go ahead. You're on the air, and thanks for calling.
Hi, Dr. Portner. I was really interested to know if you had an office at Kaneohe yet.
Yes. The answer is finally yes.
Oh, good.
Yeah, I should have the address handy, but I don't. I'll have the address for you next week, and we're opening up, I think, the second week of January. But I'll have official information coming up. What you can do is call the office, because the phone number will be the same. We have one main phone number.
Okay.
And if you call the office, they can give you all the particulars. But the happy answer is yes. Starting in January, we're going to have a clinic part-time at first. But we sublet some space in a very nice physical therapy office. and we're going to test the waters that way. So we'll see if we're well received, and if we're needed out there, and if people come, we'll be able to expand and open up more hours. If not, it's worth a try. I've been talking about it for years.
Yeah.
And
we don't have any other.
I know that.
Only one.
Yeah.
It's not so good.
Well, we'll try our best to be better.
Okay, because I will be there.
All right, Rose. Well, thanks so much for calling. And just call the office for the opening date, which is early January.
Okay,
And the address, I don't know, but Kapolei's not that big.
No, it's not. I'll find out.
Area. Okay, Rose. Thanks, and have a happy holiday.
Happy holiday. Merry Christmas.
You too.
Bye-bye.
Bye-bye. Yes, indeed. Here I am, about to be 65 in April, and contemplating, I was contemplating retirement. I don't even like to use the word. And then I tried to imagine myself retired, and I saw a bunch of old guys like me sitting around in Manoa Marketplace in front of a coffee shop talking story, and it was sort of I had the morning off, and it was sort of I was sort of practicing semi-retirement there, and I imagined, geez, if I retire, I could be sitting at that table with these old geezers talking about nothing, and I just didn't see myself doing that yet. Not that I don't like to sit around in a coffee shop and talk with a bunch of old geezers like myself. Nothing wrong with that. But I'm not quite ready to sit around and do nothing just yet. So instead of retiring, what am I doing? The opposite. I moved to a nice big clinic, signed a big long lease, hired a new doctor, opened a new clinic. I'm starting a new weight loss program. I'm very excited about, very, very excited about it. I've been devoting almost every waking hour when I'm not working on seeing patients and trying to put together a weight loss program. For years, I've been telling my patients that have bad arthritis in their knees and hips and bad arthritis in their lower backs that not only can I try to help them get over this episode, but more difficult is to try to prevent future episodes. And one big way of minimizing these arthritic conditions is by losing weight, especially if you're quite massively overweight. And by that, I mean there's a measurement called the BMI, which is the basal metabolic index, and the mass index, body mass index. And this is a measurement of sort of a ratio of your body weight and body fat. And when your fat content becomes too much of your total body weight, you exceed this certain index. We arbitrarily set a ratio of 30 as the number to look for where we define actual obesity. Anyway, that is not a good idea, this obesity business. And even the word is not, people don't like to hear the word. We call it overweight, but medically there's a term obesity. It means a high BMI. And for years I've been telling people, look, you got to lose weight. You got to lose weight. Eat less, exercise more. Everybody knows the rules, but very few people can accomplish it. And not that many programs are effective in the long term either. So why do I think mine might be different and mine might be better? Well, to be honest, I don't know if it will be, but I intend it to be. I know that if patients follow my advice and follow the program, they will lose weight and keep it off. But it's a big if, because to be honest, all diets work. It's just a matter of sticking to the program and wanting to be. It's not just diet, it's attitude, it's a conviction that you want to do something for yourself. And live a better, healthier life and avoid the complications of being overweight and decrease the problems that you're having with your arthritis, decrease that by getting some of the weight off. And it's incredible. They do studies that show that just a modest amount of weight loss can make a huge difference in a patient's discomfort levels and functional levels. Anyway, no one's going to argue that losing weight's a good idea, but if you're overweight. But I'm actually getting back into the field. I used to, as an internist, I was very, very interested in weight loss because it seems so much easier to avoid problems that are avoidable by watching your weight, rather than trying to treat the problems caused by being overweight after they're already present. It's like herding cats, basically. You just chase all these complications that, geez, it would have been a lot better just to not have gotten there in the first place. Anyway, this is a program my trusty business associate has named it the Portner Protocol, which I don't exactly like having my name attached to the program, but there it is, and they've already printed up the brochures and all that, so we're stuck with the Portner Protocol. But it's going to be a weight loss program. It's very low calorie, high protein, and safe and monitored and medical in every way. And we couple that with the proper exercises, and I'm very excited about it. A new program. It's always nice. Why retire when you can learn a new field and set up a new program that can help people? So I'll talk more about this in the coming Saturdays, but what a great gift for someone you love is to get them started in my new weight loss program. And instead of buying stuff that ends up in a closet, some gadgets and gizmos and stuff you don't need, you can give them a gift that will last a lifetime and extend that lifetime. I can't think of a better holiday Christmas gift than that. And if you want more information about the weight loss program for you or someone you love, you can call the office and they'll have more information as it develops. This is a project in process. But we have a target date, a soft date, to start this early to mid-January, so just a few more weeks. You can call the office 596-7300. Ask them about our weight loss program, and they'll fill you in as the information becomes available. That is cost, start date, and so on. The number here, 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back pain. Did a great case earlier this week that I can share with the audience here. I had a patient who had rather severe back pain for many months, and by severe, I don't mean the kind where you can't get off the floor and you have severe muscle spasm. I've seen plenty of those. This was severe in the extent that the patient needed narcotic medications to be comfortable, and also to the extent that they couldn't function on the level that they were used to. They couldn't do their usual exercise, and they couldn't comfortably take care of their chores around the house, and it was hard to do their work at work, and they were losing time off from work, and what else? Their sports activities were curtailed, and they weren't sleeping very well. It was serious. It wasn't screaming excruciating, but it was serious. And they had been to several doctors and told this and that. It's a shame. I can't even tell you some of the things that my patients are told. You know, you're old, just live with it, or the X-ray's normal, you know. Or just the muscle, you know, it'll get better on its own, or just put some heat on it. Well, fine, but that's not true if it goes on for months. And we discovered that there was a facet joint arthritis. Facets are these little pairs of joints all up and down your spine. And we discovered by the exam and the history, and we do a little test where we block the nerve coming from these little joints, these little facet joints. And sure enough, that's what this patient had, and we ablated. We got rid of the nerves that carry the pain from these arthritic joints. And the patient came back last week and was so relieved. Their pain was gone. They were back to doing their usual activities and taking no pain medicines. And I'm choked up here just telling you about this because once in a while I really change people's lives. Doctors can do that sometimes. So it's a privilege. Anyway, I have some callers. Liz, go ahead. You're on the air, and thanks for calling.
Good morning, doctor. Thank you for taking my call.
You bet.
I have some issues. Last year, they did an MRI and X-ray on my hip and down my right leg. They said it was osteoarthritis. Now, prior to that, I had a knee problem where they had to drain the fluid, but I never had to have that done again. It was 2 years ago.
Uh-huh.
But my problem is, seems like when there's a low pressure
yes.
and the rain is getting ready to come in, it will hurt me terribly.
Yeah,
but
you're not alone in that.
It doesn't.
Yeah, you're not alone in that. The lower pressure seems to affect the achy arthritic joints. So, and what is your question?
The other question is, does osteoarthritis move around?
Not exactly.
Because sometimes my ankle goes weak and I can't walk on it. Then my knee goes out, but then that'll stop, and then the back will start.
Yeah.
So could you give me some insight on that, sir?
Yes. It doesn't roam around. If you have a pain in your back, that's one thing. It could refer down the leg and cause the ankle to seem like it's giving you trouble. But you could have a separate issue in your ankle, whether it's osteoarthritis or some other kind of arthritis or some other kind of problem in the ankle. You could have, when you have fluid in your knee, you have arthritis in the knee by definition. That's how we know it's arthritic if there's fluid in there. So you have that, and I think it's more likely that these are separate problems. The fluid in your knee is not causing your back to be sore, and the fluid in your knee was not causing your ankle to give you trouble. So it's more than one problem. That's the point. It's not like, my osteoarthritis migrates from place to place. That's not how it works, no.
Could I ask you, now I had breast cancer 2 years ago and I got the chemo and radiation. Would that affect it in any way?
Well, probably not. I mean, whenever you have cancer, God forbid, there's a possibility that it spreads, that what we call metastasizes.
Well, they said it didn't metastasize.
Right. So I only bring this up, you're very fortunate, because sometimes people have a history of cancer and they come to me with back pain, and it turns out that it did metastasize to the backbone.
Yes, sir.
So I'm sure that they're keeping track of that. But short of that, no, I don't think that the two are related.
What about the white cell count? Would that have anything?
No, your white cell count maybe went down with your chemotherapy and so on. But no, that's not what we look for when patients come with knee pain or ankle problems or back pain. That's not usually the problem. That's a big, big problem. If someone comes to me with back pain and I notice their white count is low, that wouldn't be a good idea, a good situation. But it rarely happens. There's no reason to think that. Okay, Liz?
Thank you so much.
So have these things addressed one by one. There may be a connection, either direct or indirect. But the good news, Liz, is all of these things are quite treatable. So don't just live with it. See your doctor or come in and see me, and we'll take care of it for you.
Thank you so much.
All right, Liz, have a happy holiday.
God bless you also.
You too. Bye-bye. Let's see, another caller, Rodney. Rodney, go ahead. You're on the air, and thanks for calling.
Yes, Dr. Portner. Have you ever treated patients that had muscle weakness or muscle wasting
Yeah.
Due to a side effect of taking statins.
Yes.
And what kind of treatment did they get?
Usually you have to stop the statins, and it's often reversible. So the first step is, because just because you're taking statins and you have muscle problems doesn't necessarily mean the two are related, but statins are known to cause muscle problems. So if your doctor has evaluated you and said, yeah, this weakness you're experiencing and this muscle symptoms you're experiencing are a side effect of the statins, I'm sure they took you off the statins. Am I right?
Yes.
So that's the number one treatment. Oftentimes it is reversible. But sometimes it's only coincidence that there's a muscle problem in a patient that's taking statins, but it's due to a cause other than the statins. It's just incidental. So it's confusing, and it's smart to stop, but it's not smart to make that assumption, and other possible causes should be explored. How long have you been off the statins now?
Oh, about 2 years. When I first experienced it, he gave me the very lowest dose, about 20, I guess 10 or 20 milligram, whatever. And then it was a lopopromine or something. I forgot the name of it. But I took it for about 2 months, and he told me to watch my diet. I cut out a lot of the, the fats and stuff like that. And I took that pill, and then all of a sudden I developed a weakness in my right leg, in the hamstring.
It was called lovastatin.
The lovastatin, yes.
Yeah.
And
it was sudden, huh?
Yeah, I mean, I never felt that kind of pain before. I've had muscle strains and muscle,
Because usually, in my experience, muscle problems related to statins are more spread out. It's not usually a sudden onset in one area.
Oh.
Did you ever see an orthopedist or neurologist or someone like myself to make sure that it was the statin?
No, he just told me to stop the drug. He gave me a blood test. He said, it's fine. So it didn't seem that it was causing it. But then later on, I tried to keep away from it and, just exercise it out, and it still wouldn't get better. So a couple months later, I saw him again, and he said, you know what you got? You got sciatica. And that's been a long process for me.
Rodney, I'm not happy with this conversation on several levels. Sciatica is not a diagnosis, so when your doctor says you have sciatica, fine. That's pain in your thigh.
Yes.
That's not a diagnosis. It's a symptom. It's like telling you go to the doctor and you say, doctor, I have a headache. And he takes a blood test and he says, you know what you got? You got a headache. So you can't use sciatica as a diagnosis. I suspect, although I don't want to second guess your doctor otherwise because he's your doctor and he's seen you, but I suspect there's a high likelihood that your sciatica, which you do have as a symptom, not as a diagnosis, as a symptom, you have pain in your leg and the back of your thigh, has nothing to do with the statin. It's fine that you're off the statin. Just control your cholesterol if possible by managing your weight. Are you overweight?
No.
Good. So just, eat properly and exercise and see if you can't improve your numbers. I think that whole statin thing is overrated, and I'm not a conspiracy theorist, but I think the pharmaceutical industry oftentimes push upon us with TV ads and all that.
Yes.
All these drugs they have for conditions that may or may not require their treatment. So, and how is your cholesterol and all that without the statins, and now that you're watching what you eat? Is it acceptable levels?
I haven't gone back to check it, but I feel all right.
That doesn't count. You can feel all right with bad numbers. The idea is to prevent heart attacks and strokes. But what you need to do is have your sciatica evaluated for causes other than statins. Statins don't particularly cause isolated, one-sided sciatica. It's more like achy all over kind of thing.
I see.
Yeah.
So anyway, he gave me a physical therapist to go to, and I went through that program for about 2 months, and it was good. It was good. It helped me
good, because the physical therapist knew what they were doing. but the doctor didn't really give you a proper diagnosis. Is your sciatica coming from your SI joint, from your facet joint, from a disc, from a stenosis, from a hip problem? I mean, there's a list of 5 or 6 common causes of sciatica. Statin is not on that list, by the way. And it can be sorted out. So if you're still having problems with it, don't give up. Try to get a diagnosis. I'd be happy to see you to make that diagnosis.
Okay.
And once the diagnosis is made, that is, what is the source of your sciatica? Then we can treat it specifically in most cases, not in every case, but in most cases. But that would be the way to go, Rod.
Okay.
All right, have a Merry Christmas and a Happy New Year, and thanks for listening, and good luck with this sciatica. And remember, everybody, if your doctor tells you you got sciatica, you look at them with one eyebrow up and say, what? That's just my symptom. What's causing it? And that'll make them think a little bit more, okay?
Okay, thanks, Al.
All right, Rod, take care. You're listening to Dr. Bernie Portner. Welcome to The Moving Body. If you just moved in, I'm your host today and every Saturday at this time to take your calls and try my best to answer your questions regarding arm, leg, neck, or back problems. We have another, 20, 25 minutes to go in the show. Plenty of time for your calls. 521-8383. Neighbor Island listeners and also people on the mainland who enjoy the show through iHeartRadio can call toll-free at 1-888-565-8383. The lines are open for the first time since this show started, so you can get through right now, but that may not last. Here already comes one call. Here comes another second call, so don't hesitate. If you want to ask me about your shoulder pain or your bursitis, or your sciatica, for goodness sakes, or why the heck are you on statin drugs, or anything else, I'll give you my 2 cents for what it's worth. That's about what it's worth. If you don't want to call, but you want to visit the new office, you can call 596-7300, and we'll be happy to make an appointment to see me or one of my associates, either in town or in Kaneohe, or starting in January out in Kapolei. So we got the island covered pretty much. Let's see, George, talk about Kapolei. Here we are in Makakilo. Go ahead, George. You're on there, and thanks for calling.
Yeah, hi, Doc. I've been listening to you for a long time.
Oh, thank you very much.
And talking about the cholesterol medicine and stuff, and the aches and pains.
Yeah.
Well, they put me on the same thing for cholesterol, and I was fine, and then I started getting these pains in my shoulder, or like above my collarbone. And so
on one side or both sides?
Both sides, but mostly on my right side. And so what I did is I went to the doctor, and he sent me to a sports medicine doctor, and that doctor was giving me the shots in the shoulder.
What kind of shots?
I'm not sure. Whatever that stuff is that they put in there.
Probably cortisone shots?
Yeah, that's what it is.
Was he using an ultrasound machine or a fluoroscopy machine when he gave you the shot, or he just gave you a shot?
No, he just gave me the shot.
Did it do the trick?
It would for a couple days, and then they kept blaming it on my paddling and my surfing, and I said, no, this ain't right. So I quit the cholesterol medicine, and it went away just like in 2 days, and I've never had the problem since.
Well, that's not science, but it sure is convincing, isn't it?
Oh, yeah, it was for me, and it was like...
How's your cholesterol?
I'm sorry?
How's your cholesterol doing?
Well, it's probably a little high, but I'd rather...
Are you in shape? Are you overweight?
Oh, no, I'm in good shape. I surf every day.
Oh, you surf every day?
Yeah.
What are the waves out there right now? Is there any?
Oh, they're pretty small over on the south side.
I know. There's supposed to be something coming tomorrow or Monday.
Well, that'd be great.
The reason I asked is I have a plan to maybe go out to Eva Beach today with my daughter to see a car. She's looking at a used car. I said I'd go with her, and I said, listen, as long as we're going out there, maybe we'll hit White Plains or Shark Country or
Yeah, you could do
Howe
that.
Bush. I've been to Howe Bush over there. But it's going to be small, huh?
Right. Well, White Plains would probably be your best bet, and then it would probably be about might be good for her because it'd be about a foot and a half.
Oh no, this is a big daughter. She charges big waves.
Oh, okay.
I'm the guy that needs little waves. No, she charges.
Okay.
Yeah.
No, but it'd be small then for her.
It's gonna be small, but maybe just to get wet. Anyway, monitor your cholesterol and all that. I don't want to downplay that. There's a lot of research that says if you can lower your certain cholesterol fats and raise others, that you might have a better chance of avoiding heart disease and so on. There's something to that.
Yeah, absolutely. But I just wanted people to know that if they are taking these cholesterol medicines and they all of a sudden feel these pains that they've never had before, I would bet them 99% it's that med that they're taking.
It might very well be. And stopping it, in my experience, usually does reverse it. That's why I was so skeptical of this guy who stopped it 2 years ago and is still suffering. So, I don't take them. My doctor put me on them for a while, and then I thought about it, and now I just watch my weight and I watch what I eat, and my cholesterol is reasonable, and I'm just going to stick without it. I don't want, all these. I'm a doc, and I'm a MD, and I learn I'm a medical doctor. I'm supposed to be into medicines, but I don't trust the pharmaceutical industry. I don't trust them to tell us if something's wrong. They've already proven that for profit, they'll hide certain complications until they have to divulge it. And I don't like how they push their drugs on TV. So patients come into my office and say, hey, I saw this on TV. I'm sure that's what I have. Will you prescribe this for me? And I say, excuse me, that's not how this works, And they got just about everybody and their uncle and aunt on statins, and many of them are suffering with muscle aches and pains. And I'm not so sure that it's saving lives, to tell you the truth.
Right. And I agree with you 100%.
Yeah. All right, George, well, get out there. Maybe go to the north side. You'll find some waves.
Yeah, well, I'm too old for those near drowning experiences.
Oh, yeah. Those days are over for me also. I'm done with that. But, you know what I've been doing on the south side? I've been standing up. So, that's a good exercise, and I actually catch waves, more waves than anybody else. Cause
there you go.
It's such a big deal.
Well, I enjoy your show a lot. Hey, thanks for having me.
Have a nice holiday, George, and thanks for listening.
You.
Yeah, bye-bye. 521-8383. Let's say Ricky in Leleha. Ricky, go ahead. You're on the air, and thanks for calling.
Hey, thanks, doctor, for taking my call. Yeah.
You bet.
I'm 54 years old.
Yes.
And I play tennis once a week, and I golf once a week. And I've been having like this stiffness and a little bit pain on the upper part of my shoulder blades and it's more on my right hand. It's like my rotator cuff is like bothering me a little bit.
Maybe. How's your neck?
In what sense? Stiff?
Well, let's see. Are you driving or are you home?
I'm at home right now.
In the sense that when you move it to the extreme, you look way up at the ceiling or way behind your affected shoulder, does it increase your shoulder blade pain or your hand symptoms or your shoulder symptoms?
Not really, Not at this point right now. But
has it ever?
Yes, it does. It did before. After maybe a day after I play and stuff like that. So
let me ask you this: when you raise your arm up to the ceiling with your bad shoulder, does that hurt?
A little
bit. When you reach behind you, like you have to scratch between your shoulder blades, does that hurt?
A little.
Yeah. So, when somebody has pain in the shoulder blade, and down the hand, it's sometimes coming from the neck, but it could come from a problem in the shoulder, either a tendon or a bursitis or a capsulitis, the joint itself. And sometimes those symptoms can cause pain down the hand, not usually in the shoulder blade, though.
And then, every so often I have this like this tingly feeling on the left side of my shoulder going down a little bit to my backside.
Uh-huh.
You know, on my shoulder blade going down.
Right.
And then, you know, if I stretch it out a little, it does go away, and it comes and goes.
How long has this been going on?
Not that long, maybe about a month or so.
And is it getting worse or better, or just hanging in there?
Hanging in there.
Yeah. So, you need a diagnosis, and without that, it's frustrating to try to give you advice other than you need a diagnosis. But it certainly could be some kind of problem related to your shoulder and tennis.
Yeah.
It could be a spinal problem, and it could be both. And it's, the good news is, whatever is causing this, it's pretty easy to figure it out with just a physical exam. Sometimes certain tests are needed, but the physical exam, most of the time, will tell me pretty much what's going on, and then I can give you advice on how to go about fixing it. In the meantime, you want to try to avoid doing what you know hurts. If tennis aggravates it, hold up on the tennis until you get this sorted out. Don't keep injuring it.
And do you do this type of stuff, diagnose?
That's exactly what I do. That's all I do.
Because
it's my life.
Because guys tell me maybe go shiatsu or...
Well, you see, that's a very good point. I got nothing wrong with shiatsu. I got nothing wrong with acupuncture. I got nothing wrong with chiropractic. I'm in favor of all these things, especially if they work. But what I really think is important is that we first seek a diagnosis.
Right.
How are you going to fix something
if you don't know what the problem is, right?
Right. If you got a leak and you're leaking oil, you're not going to fix that leak until you figure out where the leak is.
Okay.
Right? And same with your body. You're not going to fix this. Yeah, go to shiatsu, try acupuncture. There's a menu. It's like going to a restaurant. There's a menu of treatments out there.
Right.
And you can go to a shiatsu guy, and what are you going to get? You're going to get shiatsu. It doesn't matter what the problem is.
You might be fixing the wrong problem, right?
You might not be addressing the problem at all.
Yes. Okay.
So find out what this is. It's usually not difficult to figure this out.
And, in town, where is your office?
Right downtown on Bishop Street, 1132 Bishop, that big red granite building right on between 4th Street Mall on one side and Bishop on the other, on the top near Beretania.
Oh, okay.
1132. Plenty of parking. We validate. It's real easy to get to. It's real easy to get an appointment, and it's usually pretty easy to get a diagnosis.
And would you be the doctor, or would...
It depends on who's busy.
The schedule, Okay.
It depends on your schedule and mine. I have one more week of work, and then I'm off for holidays. So me or Dr. Bro or Dr. Fernandez, this is not rocket surgery here. We can figure this out, any one of us. And once we know, then we can tell you, listen, you need to have this therapy, or listen, you need to have this shot, or here, you need to take these pills, or, there's various treatments, but they all depend first and foremost on understanding what's causing the problem.
Yeah, and once I know the diagnosis and stuff like that, I'm not too enthusiastic about the shots or the pills. I want to try more.
Yeah, most of the time we can get people better depending on the diagnosis.
Yeah.
We can get people with the therapy. So come on in and we'll see if we can't figure it out.
All right, doctor, you'll be seeing me soon, maybe early next year sometime.
There you go.
Okay, I thank you.
All right, go easy in the meantime and have a great holiday.
You too. Thank you very much.
Right.
Okay, bye.
Yeah. It's funny though, I see patients and they come to me with various problems, and it's sometimes it's pretty challenging, and we sort it out, and they say, I want to get back to work. I had this guy yesterday. I want to get back to work as soon as possible, but I don't want to take the medicines you prescribe. And my answer was, you can't do both. You can't want both. Yes, you can get better probably without my medicine. It'll be more slow. The reason I intervene is to speed up the recovery process because, let's be honest, many orthopedic conditions, if not most orthopedic conditions, will essentially and eventually resolve themselves with proper rest and time and so on. We do heal, but it can sometimes take weeks or months. You go to the doctor because you want this process to hurry up so you can get back to work, so you can get back to play, so you can get back to doing your chores. But you can't come into my office and say, please diagnose me. Yes, I can try to do that. And I really want to get better as soon as possible. But no shots, no pills, only natural way. That's not going to cut it. I mean, I try my best. We do use alternative treatments in my office. We use acupuncture and massage therapy and physical therapy. And those are all very useful and have their place, and they're part of my weapons, my armamentarium. They're in my quiver, so to speak, of arrows that I have to try to slay these conditions, but they're not alone. And sometimes there's nothing like a certain type of injection, or sometimes there's nothing like a certain specific medication to take. Or sometimes a certain procedure can really be safe and move things along. So the last thing I like to hear is, yes, I want you to help me, but I want to tie both of your hands behind your back first and then help me. Well, I can try, but sometimes it's hard enough when I have both of my hands to work with. It gets a little bit more difficult when my hands are tied. So let's not put too many preconceived limitations. I mean, sure, a lot of people say, I really don't want surgery, and I can relate to that. And sure, people can say, I really don't want a cortisone injection. And I can relate to that to some extent. But there comes a point in time, 2 weeks later, 3 weeks later, 2 months later, when we've tried a bunch of other things and they haven't worked, and I think a small amount of cortisone put just in the right place very carefully will cut this off quickly. I can't help but revisit that option and try to convince people, listen, cortisone is not as evil as you hear out there. It can be. I've been working with cortisone and steroids for over 40 years, believe it or not. And I've had very few problems when used properly and for the right conditions and for the right amount of time and the right small doses. It can be a godsend. I've really helped a lot of people with cortisone, and it doesn't get the credit it deserves. What it does get is a bad reputation, and why? Because it's abused. So you hear the nightmare stories. You hear that some guy, some sports star kept getting repeated cortisone injections and sent back out to play, and over and over and over, and ended up with very bad complications. Or you hear that some people who have to take cortisone for other conditions like bad asthma or bad arthritis. There's certain conditions where even though there's high risk of complications of taking cortisone by mouth every day, the risks are outweighed by the benefits. The patient needs it because without it their life is even worse. So we always weigh the risks and benefits, and people hear these stories. Yeah, I heard somebody was taking cortisone and developed osteoporosis and developed all these other problems, which is true. But that doesn't mean that if you have an isolated tendinitis in your shoulder or capsulitis in your shoulder and you've been suffering for months and you've tried everything under the sun and you still can't sleep and you still can't surf and you still can't play, that you shouldn't try a tiny injection if it's recommended. That doesn't make sense to me. So caution is the key word, but let's not be hard-headed now, like we can be around here. 521-8383. We have maybe 5 minutes, so enough time for perhaps one more call. If you're listening from Neighbor Island, 1-888-565-8383. While I'm waiting for the next and probably last call of the day, let me just share with you a little more excitement. Not only are we opening up a new clinic in Kapolei starting in January, and not only are we starting a weight loss program called the Portner Protocol, of all things, in January. So that's something you can do for yourself or for someone you love. How's that for a gift of life, a gift of health, rather than some sort of gizmo that's going to end up in a drawer someday? You can give a gift of health and send by somebody their first month or their first 3 months of this healthy weight loss program. That would be great. I'll have more details, and you can call the office 596-7300 about Kapolei and about the weight loss program. But not only are we having those two programs, but also on Tuesday I'm scheduled to begin my use of stem cells in the treatment of difficult orthopedic cases, even joint problems. So the company I use is Harvest Tech. They're out of Germany, and they're sending me a instructor, a representative, to go over the protocol. I've already been to the Bay Area a few weeks ago to see the procedure and to talk about it and learn about it, but now I'm going to bring it to Hawaii. Actually, this guy from the German company is going to bring it to Hawaii. He says no one else is doing it here. It's quite safe. The studies are coming in that it shows that it is more and more effective. So suddenly, not only do we have our usual treatments for difficult orthopedic problems like physical therapy, cortisone injections, hyaluronic injections, even PRP, which is another form of stem cell. But now we have stem cells derived from fat. So that's starting this Tuesday. So very exciting about that. And here it is. Here I am thinking about retirement just a few months ago. And instead I have all these new things going on in my professional life. New office, downtown office, Kapolei, new weight loss program that I'm really happy about, and all these other things. So exciting stuff to come in this new year. Meanwhile, speaking of New Year, I want to wish everybody a Merry Christmas and a Happy New Year and a safe one. Be careful out there. We don't mix driving with drinking. Give the gift of life. Think about that. Give somebody a gift to help them lose weight. I'll be back next week, hopefully. Never know. In the meantime, have a great weekend. I really appreciate all you guys listening to my show so loyally. Take care, and we'll see you next week. Thank you for listening to The Moving Body. I hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back, and would like to get an appointment over at the office on Pe'ikoi Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray is normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to